Disclosures for this and all episodes in this series can be found on the podcast series destination page, located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast was developed through a strategic collaboration with the National Alliance on Mental Illness, supported by an independent educational grant from Takeda.
Hi, my name is Dr. Rakesh Jain, and I am a clinical professor in the Department of Psychiatry at Texas Tech University School of Medicine here in Texas. And everyone, welcome to this podcast episode, Depression and Treatment. Is it a symptom or a side effect? This is part of the 6-episode podcast series, What to Know About Depression. Today, I'm speaking with Dr. Denise Vanacore. And Dr. Vanacore, can you please tell us a little bit about yourself and your work with people who are living with depression?
Well, yes, and thank you for having me. My name is Dr. Denise Vanacore, and I'm a board-certified family and psych mental health nurse practitioner. I work in an integrated primary care and psych mental health practice, and I'm the Associate Dean for Eastern University in the nursing department.
Wonderful. Welcome. Thank you so much for being with us. And today we are specifically talking about major depressive disorder, or MDD, or what we commonly refer to as depression. And this is one of the most common mental health conditions in the US. And depression is a mood disorder that causes feelings of sadness that won't go away and a loss of interest in things you normally enjoy. And while everyone can feel sad once in a while, when you're living with depression, it's more than that. And with this condition, people feel depressed most of the time, for most of the week. It's a real challenge. It can affect how one feels, thinks, acts, and can lead to emotional and physical problems. And for many people, their symptoms with depression are bad enough to interfere with their daily activities. Dr. Vanacore, can you tell us a little bit about what kind of symptoms people can have with this condition?
Well, sure. There is a really wide array of symptoms that you can have when you have major depressive disorder. So with depression, or MDD, as it's often referred to, symptoms happen most of the day and nearly every day for 2 weeks or more. And while the main symptom is a depressed mood or loss of interest in activities, there can also be many other symptoms as well. So these include things like tiredness or lack of energy, feeling sluggish and physically or mentally slowed down and not your sharpest, problems with sleep, gaining or losing weight, having trouble concentrating or having memory problems, or even having difficulty making certain life decisions, having unexplained physical problems such as back pain, headaches. And then depression can also affect how you feel, such as feeling anxious, agitated, irritable, restless, frustrated, or even worthless or guilty. And it can affect your behavior too, such as having angry outbursts. Some people even may have recurring thoughts of death or suicide. So this can be a very complex condition, and it can affect different people in different ways. And really, anyone can be affected at some point in their life by depression.
Yes, it's an equal opportunity disease, isn't it? You can't really outrun it. If it is a problem, you have to face it. And up to 25% of adults can have depression at some point in their life. But depression can also happen in teens and even children. And some people may have it only once, while others may have several episodes during their lifetime. And sometimes depression can be caused by things like a major loss in life, like a death in the family, or social isolation, like happened during this terrible COVID pandemic. Life changes, such as moving or job changes or retirement, or when there's conflict in a relationship. And some people can develop depression as a result of trauma. Trauma could be physical, sexual, emotional. And, it can run in families. There is a clear genetic component to it as well. So, Dr. Vanacore, we've talked about what depression can look like and what may cause it, but what should people do if they think they're experiencing it?
Well, one of the very first things to do is really have a good heart-to-heart talk with your doctor or healthcare team member about how you're feeling and your symptoms. It is really important to be open and honest with them. It can sometimes be very uncomfortable to bring up these symptoms or these types of complaints to your primary care provider or your healthcare provider, but it's an important part of your overall health and well-being. So having a really open communication and open dialogue is really key. Depression is treatable, and the goals of treatment will be to control your symptoms and increase your quality of life and daily functioning. This is often done by finding treatments that will help you improve your mood and manage your other symptoms that we've talked about today. But treatment is going to be very individualized. Your primary care provider or your healthcare provider may recommend medication. They may recommend therapy or counseling, or they might recommend both. And there are also other treatments that your doctor can recommend as well. If they do recommend medication, they will work with you to find the right one or the right combination of medicines. Sometimes people can't be treated with just one medication. To manage your symptoms, that also has the fewest side effects. So the main medications used to treat depression are called antidepressants. Some may manage certain symptoms better than others. And that's why it's important that your healthcare provider understand all the symptoms you're displaying so that they can pick the correct medication for you. Generally, the types of antidepressants we see are called selective serotonin reuptake inhibitors, or you'll hear them referred to as SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs, or atypical antidepressants, and then tricyclic antidepressants, or TCAs, and then lastly, monoamine oxidase inhibitors, MAOIs. Your doctor may also recommend other medications to help you manage depression and the symptoms that you're feeling.
Dr. Vanacore, that's a lot of wonderful information. Wonderful. Thank you. And that's correct. We have many tools in our toolbox for people who may be living with depression, and medication is just one of them. And it is important to remember that all medications can have side effects, and not everyone, thankfully, will have all of the side effects, but they may have a variety of different ones. So it's really going to depend on which medication you're taking, as well as many other factors. But some of the side effects I have seen, and I suspect you have too, Dr. Vanacore, that can happen with antidepressants. These side effects are nausea or diarrhea or constipation, or an increase in appetite or weight gain. Fatigue, I've commonly seen, tiredness, sleep problems like insomnia or unusual dreams. I've even seen drowsiness or dizziness in some patients, also dry mouth and blurred vision, feeling jittery, agitated, irritable, or anxious. And certainly, sexual side effects can occur in some people, such as decrease in sexual desire or libido, or decreased orgasmic abilities, or erectile dysfunction. So that may seem like a lot to digest, but these are not even all of the side effects that may happen. So you will want to be sure to ask your doctor or healthcare team member for a complete list of the ones that may happen with the medication you're taking. And I'm sure that some people may be thinking, that sounds like an awful lot like symptoms we just talked about, which can actually be the case sometimes. So Dr. Vanacore, what would you tell someone who asks you, is this a symptom or is it a side effect?
Well, I would say that there can certainly be times where, depending on which medication you're taking, you may have a side effect that can seem very similar to a symptom of depression. So this is where talking to your doctor or healthcare team member is going to be especially important so that they can help you with identifying whether this is a side effect or a symptom. Again, if you remember what I said earlier, it's important that we're open and honest with our healthcare providers. Then you can find ways together to manage any side effects that you may be having. One of the common ones are problems with concentration or cognition. Because while concentration issues can be a symptom of depression, some treatments may have side effects that can make you feel drowsy or dizzy, that can affect your focus and your thinking. And then sexual issues can be a symptom of depression, but that can also be a side effect that can happen when taking certain antidepressants. Fatigue or feeling sleepy can often happen for people taking certain medications. And again, those are often symptoms of depression as well. So some patients have problems with sleep, and this is a big complaint that I hear with patients. So we always want to make sure that we tell our providers about how we're sleeping, whether we can fall asleep or whether we can stay asleep. So this can all raise a lot of questions like, is this all because of ongoing depression? And maybe it's not really fully treated yet. Or is it because the medication is causing this?
Such great questions you raise, so helpful. And this can all be tough for some people to recognize. And then to bring it up with a clinician, that can be a little bit of a challenge too. So for example, many people are reluctant to bring up sexual issues with their doctor. Talking openly may make them feel uncomfortable. But folks, it's the first step to take in order to find a solution. And many people who have been physically, sexually, or emotionally abused or assaulted, or have experienced other types of trauma, they can develop depression and possible sexual issues because of their history with trauma. What Dr. Vanacore said, the importance of talking with clinicians openly is highlighted one more time. So all of these issues can have an impact on treatment because people who experience trauma may respond to treatment differently than those who have not. It can be similar for cognition or concentration issues. Some people may be reluctant to bring up these issues, and in some cases may not even be aware that that is happening. What are your thoughts, Dr. Vanacore?
Well, with like fatigue or feeling sleepy, many people might think, okay, I just feel this way because of my depression. But open communication is key because talking openly with your healthcare provider is the first step to finding the solution. And if your healthcare provider doesn't ask about symptoms or side effects, you should feel empowered to bring them up and discuss them. Because knowing the full picture will help you and your healthcare provider find the treatment that's right for you. For example, certain antidepressants may be more helpful for concentration issues than others. And certain ones may cause more drowsiness or sexual side effects in some people than others. Also, treatment can work differently for different people. So your healthcare provider may need to try different medications or different doses to find the right one for you that reduces your symptoms of depression. It's important to remember that some medications can take several days or weeks to work, and some side effects can even go away after a week or two, but that others may last longer. So it's important to stick with your treatment plan. Don't stop or change your treatment plan without talking to your healthcare provider first. Sometimes I tell patients time might be what it takes right now with your particular medication, because stopping or missing doses may cause feelings of withdrawal, and quitting suddenly may cause depression symptoms to dramatically get worse. But you and your healthcare provider will find ways to manage your side effects together. And I know for many people, using tools like keeping a journal or diary to help record and track your symptoms and any side effects really helps with those conversations, because you can bring this up at your appointment with your healthcare provider. Dr. Jain, what are your thoughts?
First thought I have is you gave us a wealth of information. While there are concerns, Dr. Vanacore, I think your message is very uplifting, that having open conversations with your clinicians really does help. And these are really important points for our listeners to remember. So thank you so much for offering them to us. And I agree that using tools like keeping a journal or a diary to help keep track of symptoms can be very helpful. But perhaps the most important thing is be aware, as you talked about, Dr. Vanacore, and share your concerns with your provider. And because your symptoms and your side effects may change over time, you will want to be sure to record these changes and keep talking with your healthcare provider. All of this goes towards working with your clinician to make the treatment plan that's just right for you. And there may even be times when your clinician may change your dose or switch your medication or perhaps even add another medication to help you manage side effects. But as you mentioned, Dr. Vanacore, you will want to make sure that one works closely with the healthcare provider and not to on their own stop or switch medications. You agree with that?
Absolutely. And remember, open communication is going to be a key part in all of this. People should feel empowered to say, I know you gave me this medicine, but this is how I'm feeling. And this is what I think. Because what may be a symptom and what's a side effect can be really hard for someone to tell apart. So we don't expect people to figure that out on their own. But talking to your healthcare provider can really help you create the treatment plan together that will work for you.
You are really highlighting the importance of the team approach, right? Empowerment of the patient and open communication with your clinician is key to better understanding. Is it a symptom of depression or is it a side effect or perhaps even both? Well, as we wrap up our time together, Dr. Vanacore, do you have any concluding thoughts?
My other thought is to make sure that you do keep a journal and bring that to your appointment, because sometimes when we get to the appointment, we forget things we want to say. But if you've written them down, it helps the provider really have a clear picture of what you're going through, because your journal will explain.
Great words of wisdom, Dr. Vanacore. Thank you so much for joining me today. This was a really great discussion.
Well, thank you for having me. It was a great discussion, and I really enjoyed our time together.
Indeed, as did I. And thank you to our listeners as well for listening in, and we will talk to you soon.